former officials of government offices involved in vaccine procurement from the previous administration insist that everything was above board. For their part, the Senate Blue Ribbon Committee earlier vowed that there will be no sacred cow in their ongoing probe and no stone will be left unturned to find out whether the non-disclosure contracts were indeed anomalous or not. Daniel Manalastas has more.
Former officials from the past Duterte administration explained to the Senate Blue Ribbon Committee regarding the purchase of COVID-19 vaccines, particularly the non-disclosure agreement they entered into. Former officials who led the fight against COVID insisted the non-disclosure agreement is part of the process. They had no choice that time because it was a requirement of vaccine suppliers.
This institution would not tolerate any form of corruption under their watch, which is clearly stipulated on the contract having an anti-corruption and transparency clause. That the CDA, the confidential agreement, is only not allowed to be disclosed in public. But we never said that we will not allow gov't to look at it.
Former Health Secretary Francisco Duque III said they asked for a special audit in 2021 for the vaccine-related procurements.
All the letters that we have written, in fact, truth to tell, we have had a total of 14 letters and correspondences that covers ranging from request for special audit, request for performance audit, proposed timelines and deadlines for the completion.
Duque added that despite the NDA and some details of the vaccine procurement that cannot be publicized, it doesn't excuse them for COA auditing.
It's not a question of choice whether we would like to subject such contracts to COA audit. It is our obligation, very clearly stipulated in the loan agreements entered into by the Philippine government.
COA confirmed that the DOH asked for a special audit. However,
but I'd like to mention that we have already requested as early as 2021, and I'd like to confirm that they have submitted these documents. However, we still have to receive the not redacted documents.
All in all, according to Health OIC Undersecretary Maria Rosario Vergere, there are 44 million doses of vaccine wastage, and the biggest bulk of these are from the private sector.
Inventories mostly comes from the procurement of the private sector, which is around 44.82% of their procured vaccines, and coming from the local government units, which is around 33.34% of their procured vaccines. If we look at our current inventories, the national government procurement.
Senate Blue Ribbon Committee Chairperson Senator Francis Tolentino says they're expecting for another 2 rounds of hearings regarding this matter. Daniel Manalastas for The Nation.